Audio Jungle. Audio Jungle. Audio Jungle.
You're in time for yet another edition of MedFiles. This is a program that gives you an opportunity to ask any question concerning your health, and we find you the answer. So today the answers are coming from Dr. Ruben Waiharo of Elite Medical Services. Take a look.
Sasa hii ugonjwa ya mani hapa, mtu anasikia anasomeka, akuli mahindi, akuli sukuma wiki, akuli githeri. Hiyo ugonjwa unatokana na wapi?
Ugonjwa gani haswa?
Hiyo inajiita ansa. Ansa. Kwa nini watu hupata hiyo ansa?
Peptic ulcer is a general term for ulcers which are within the, let me call it, gastrointestinal tract. When you talk about gastrointestinal tract, we are talking about from the mouth all the way to the rectum. That is the GIT. But ulcers normally afflict part of that system, and most of the time in Aquaga, it's supposed to be in the stomach and in the external part of the stomach, in Itagua duodenal. Many patients normally call hyperacidity as ulcers, but that is something different, because when patient comes with signs and symptoms of ulcers, sometimes when the doctor does some investigations, they realize that the patient doesn't have ulcers. It's only just a case of hyperacidity. And hyperacidity is different from ulcers. Hyperacidity is when there is a high production of acid within the stomach cavity. And the signs and symptoms of hyperacidity, they're just like ulcers. But the ulcer in itself is just an interruption of the mucous membrane within the stomach. We normally call it kidonda cha tumbo. Just like you can have an ulcer on the skin. But that ulcer now is situated in the stomach. That's actually, we call it ulcers. And then there are two types of ulcers, or let me say there are three of them. The ulcer that affects the stomach, the wall of the stomach, is called a gastric ulcer. The one that affects the exit of the stomach is called duodenal curve. It's called duodenal ulcer. But sometimes patients have got other diseases like typhoid. They also have ulcers. But those ulcers, they are situated in the small intestines. So basically that is how I can define ulcers.
Ni kwa nini mtu ana paralyze? Sijawahi jua sababu haswa kwa nini unapata mtu labda upande mmoja amekufa upande mmoja, ufanyi kazi, miguu ingine ifanyi kazi. Na mara nyingi wanakaa hivi na angalia wale watu ambao wameparalyze. Na shida sana ni kwa sababu gani, na hiyo ugonjwa sasa unaingia kwa mwili namna gani. Na mara nyingi hata huwa wakati naona daktari kwa karibu anamuuliza kuparalyze nini wakina cough. Mara nyingine unasikia labda ni ajali, unaweza kupata ajali barabarani. Hata vile sisi tunafanya hii kazi ya bodaboda, unaweza anguka na pikipiki upate wakati mwingine umeparalyze, wakati umetoka hospitali pande moja ifanyi kazi.
Paralysis, I would say, is when there is an interruption or maybe damage to the nervous system of the body. And paralysis is actually lack of sensation or lack of function on one part of the body or a half of the body. As we well know that the body is controlled by the brain, and it is also well known that since the brain controls the entire part of the body, the left part of the body, the brain controls the other side of the body, and the left side of the brain controls the right side of the body. So when paralysis occurs is when that brain function or brain anatomy is interrupted either by diseases or maybe when there is let me talk about stroke. So when a patient has presented with a very high blood pressure, and you see one of the complications of high blood pressure is stroke, whereby there is blood vessels, they become busted, and then there is clot formation within the brain. It interferes with the delicate nature of the brain, and any interruption in the delicate function of the brain actually affects part of the body. And if you happen to have an accident, also accident is one of the causes of paralysis. If you happen to have an accident and it affects one side of the brain, it affects the other part of the body. The other thing is that you can also have diseases, and one of the common diseases that causes paralysis is meningitis. It can cause paralysis. You can have stroke, it can cause that problem, and you can even have other external forces like injuries. When you have an injury on one side of the body, you can also have paralysis. Paralysis is when the body doesn't function perfectly due to that problem.
HIV AIDS. How, as in the cure, how can it be impossible? Everything is possible with the human mind, and we are intelligent, so we have to get that cure, no matter what.
So what do you wonder? Why hasn't it been found?
Yeah, it has been for like 3 decades, and there's no cure. I'm wondering what these scientists are doing. They must be sleeping.
Okay, I would say HIV is a very queer disease. HIV is called human immunovirus deficient disease. And the reason why it has not been successful in managing that one is because we have not given enough education to the community on how to avoid it. And in case people get the disease, they become ignorant. The other thing is that this HIV virus, each time somebody gets it, scientists, they have been doing a lot of research on how they can manage the HIV, or even manage it as far as coming with a drug is concerned. Simply because the virus is in itself does not stay in one way the way it got into the body. You might get a virus today, and by tomorrow it has changed its form into another form. It changes itself. We normally call it mutation. So if a scientist has removed blood today and examines that virus, if he happens to go back again after 1 week to analyze the same bacteria, he discovers it has changed its form. So it has been very difficult to manage the disease because of the changing nature of that virus. It's very difficult. They have tried and tried and tried, but I don't. But finally, one day maybe I know they will come up with a solution. But at the moment, it is still a challenge to them.
Audio Jungle. Audio Jungle. Audio Jungle.